Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Kasim bin Abdullah. My message number is 320412211001. So I am from PHPG Healthcare College Penang, from DPH 420. So the course that I take is pharmacology for 313. So the course lecturer is Madam Nurul Amirah Zakaria. So today I will present a case study about a 24 years old female patient who had a co-infection with COVID-19 and Influenza A, H1N1. This case highlights the challenge of diagnosing respiratory infection when two viruses occur at the same time. So let's move into the slide. So introduction. So COVID-19 and influenza H1N1 are both viral respiratory infections. COVID-19 is caused by SARS-CoV-2 virus, while influenza A, H1N1, is caused by an influenza virus subtype. Both viruses infect the respiratory tract, and they can sometimes occur simultaneously in the same patient, which is called co-infection. This makes diagnosis more difficult because the symptoms are very similar. Patients infected with COVID-19 or influenza commonly show similar symptoms. So the similar symptoms is fever, cough, shortness of breath, and fatigue. Because these symptoms overlap, doctor may initially misdiagnose the infection unless laboratory tests are performed. So we go to the patient background. The patient background is 24 years old female from Wuhan, China. She visited the hospital after experiencing several symptoms. These symptoms include fever lasting about 10 days, and patient having a dry cough, abdominal pain, and diarrhea. Due to the long duration of fever and respiratory symptoms, doctor suspected a viral respiratory infection. So next. So diagnosis test. Doctor performed several laboratory tests to evaluate the patient condition. These tests include white blood cell count, line pockets count, and CRP, which means the C-reactive protein. These laboratory tests help doctor detect inflammation and infection in the body. So imaging and virus testing. In addition to laboratory tests, doctor perform radiological imaging and viral testing. CT scan was performed to examine the lungs. Doctor also conduct RT-PCR testing to detect the COVID-19, influenza antigen testing to detect the influenza A, H1N1. These tests are important for confirming the exact cause of the infection. Test result. The result shows that the patient tested positive for influenza A, H1N1. Later, the CT scan revealed the ground glass opacity in the lungs. Ground glass opacity is a common radiological finding that indicates viral pneumonia. In this case, the pneumonia was associated with COVID-19 infection. So the treatment plan, the medication includes Oseltamivir, which is an antiviral drug used to treat influenza infection, and Levofloxacin, which is an antibiotic used to prevent secondary bacterial infection. The patient was also monitored through physical examination and imaging tests. So patient condition. Before treatment, the patient experienced fever about 10 days, dry cough, and abdominal pain. After treatment, her condition improved significantly. Her body temperature returned to normal and her symptoms gradually improved. This shows that early diagnosis and proper treatment are very important. In conclusion, this case study shows that COVID-19 and influenza A can occur together in the same patient. Because both infections produce similar symptoms, diagnosis can be challenging. Therefore, laboratory testing, PCR testing, and CT imaging are essential for accurate diagnosis. Early detection helps doctors provide appropriate treatment and improve patient recovery. So, thank you.